If you're a doctor who treats patients with injuries from motor vehicle accidents and you've received reports from independent medical examiners or medical record reviewers and you have questions about those reports, this video is for you. I perform independent medical exams as well as medical peer reviews, and today I got a phone call from one of the providers that received one of my reviews, wondering if I would mind talking to him about why I denied some of the care that he provided. He was very polite and respectful, and I said, yeah, I'll talk to you. And so we spoke on the phone for more than 20 minutes, and he was asking me, oh, why did you, your report says, I have it here, it says ranges of motion are noted as limited, though it is not indicated to which body region this applies. And I wrote that in my report because his notes were checkoff mark, and it just said, ROM, limited, fair, good, normal, right? And it was a check mark. But no, was it the neck? Was it the low back? Was it a shoulder? Was it a knee? Was it a hip? Was it a wrist? Like, what was it? It doesn't say. So I said, well, that's why I wrote that, because there's no way for me to know that. And I did have your notes, and your notes were not well documented. And he said, well, didn't you have my initial exam note? And I said, no. The initial exam note wasn't part of the review, so I didn't have it. I said, and not for nothing, you can't have a really nicely written initial exam report and then have garbage daily notes, right? Like, you have to put in every note, what are you looking at? Is it the spine itself? Is it the neck specifically? Is it a wrist? Is it an elbow? Like, if you're going to talk about range of motion, you have to say which body region it is, right? So he understood that. And then he was wondering about therapeutic exercises versus therapeutic activities. So I explained, do you have a CPT code book? Like, I asked him, and he said no. And I said, you really need to get one and read the definitions of these codes, because you cannot use it interchangeably. I made a video that you previously that you can watch that kind of talks about the difference between those. I said, they're not one and the same, right? If you're doing, dumbbells, shoulder exercises, that is 97110. It's not therapeutic activities. Walking on a treadmill is not therapeutic activities. So you have to be mindful, if you're doing, 23 minutes, build 2 units of therapeutic exercises and don't even build activities, because you're not doing activities. And he was like, oh, so if I'm doing, sit to stand and getting in and out of bed, I'm like, yeah, that's therapeutic activities. But first of all, you have to do it. Second of all, you have to do it for a specified amount of time. And third, you have to document it appropriately so that I know what you've done and why you've done it. Like, if you're just teaching them to sit up, to, go from sit to stand, that's great. But unless they're having trouble with going from sit to stand, that's not medically necessary, right? So you have to document that there is a problem and that you are doing this to fix that problem, right? And then while I was on the phone with him, because I pulled up the report, I noticed that he had billed 97032, which is attended electrical stimulation. And I said, hey, let me ask you, I noticed you built this code. Are you using, sticky pad electrodes and then, leaving the patient there? He's like, yeah. I said, you're billing the wrong code. That's attended electric. You're using like probes, and you have to be literally constantly attending the patient for the entirety of the, using the modality. So if you're putting sticky pads on them and walking away, that's unattended electrical stimulation, 97014, or more commonly G0283. And I said, because I denied, right, 97032, because that's not what he was doing. And he was like, oh, like his mind was blown. He was like, oh, none of us have ever heard of that before. And I'm like, you really need a CPT code book and read the definitions of these codes you're billing. And he seemed really wanting to understand. He wasn't yelling. He wasn't saying, you don't know what you're doing. No, it was very, very respectful, encouraging conversation. And I'm happy to do that. If you ever have questions about your reports, feel free to call the doctor. If you do so in a friendly, professional way, most of the time they'll talk to you. And hopefully now if I get one from this doctor again, and maybe he'll do things right now, because the notes were like one of those like ditto forms that you just check the boxes on. I told him, I said, you've got to redo all of your notes. Like, this is not, it's not good enough. It's not good enough to get your bills paid and everything approved. So overall, he did a good job. He just needs to do a little better on that. And now he learned something new about the codes. So we had a really nice, respectful conversation between the two of us. He learned something, which is really great. I also suggest, I cite everything in my reports. Like if I deny a code, I write the reason why I denied it, and I provide a citation for what I used to make that decision. And I said, did you read the reason I denied it? Well, yeah. And I said, well, did you read the citation? He said, well, I didn't have time to read all of it. I just saw that you denied it. I said, well, sometimes you have to do a little work on your own, do a little homework. I said, get a CPT code book, learn the definitions of these codes, make sure that you're using the proper ones. I said, and read the research, from the clinical practice guidelines. And there's multiple practice guidelines. There's ACOM practice guidelines, ODG guidelines. There's chiropractic clinical practice guidelines, right? And they're all very similar, maybe not exactly the same, but they're all very similar, looking at the research of these different codes and what is, reasonable, related, and necessary, right? So anyway, if you ever have questions about your IME reports or the medical record review reports, we all put our names on our reports, contact information. If you have questions, reach out. We're happy to talk to you because we don't like denying care. We really don't. We're like, oh man, if they just use this code, Anyway, that is my thoughts for today. And I'm sorry it's been a while since I posted anything. I will do better about getting things up there a little more frequently.